Here we'll learn the embryology of the respiratory system, with a focus on the development of the tracheobronchial tree. To begin, start a table and denote that the respiratory system arises from the endoderm and mesoderm. Endoderm gives rise to the mucosal lining of the bronchial tree and the epithelial cells of the alveoli, which are the sites of gas exchange. Mesoderm gives rise to the supporting muscle and cartilage of the respiratory tract and to the visceral pleura of the lungs. Denote the following key stages of development: embryonic, pseudoglandular, canalicular, and saccular. The embryonic stage lasts from approximately 26 days to 6 weeks and is marked by the appearance of the respiratory diverticulum. The diverticulum gives rise to 2 lungs, which comprise 5 lobes and 18 to 20 bronchopulmonary segments. Additionally, the stem of the diverticulum gives rise to the trachea, referred to as the windpipe, and the larynx, referred to as the voice box. The pseudoglandular stage lasts from approximately 6 to 16 weeks and is marked by the appearance of terminal bronchioles. Histologically, lung tissue from this phase appears glandular. The canalicular stage lasts from approximately 16 to 28 weeks and is marked by formation of respiratory bronchioles and their associated vasculature, and by the specialization of lung epithelium. The saccular stage lasts from approximately 28 to 36 weeks and is marked by the appearance of primitive alveoli. Formation of mature alveoli continues throughout childhood. Be aware of intertextual variation regarding these stages. For example, some texts do not describe the embryonic period, and others refer to an additional end stage, the alveolar period. Let's illustrate events that begin around week 3. First, draw the foregut and show it gives rise to the respiratory diverticulum ventrally. Label the tracheoesophageal ridge, which is where the 2 structures are continuous. Show that the respiratory diverticulum is surrounded by and grows into the splanchnic mesoderm. Next, show that by week 4, the tracheoesophageal ridges meet and fuse at the midline to form a septum. Thus, the esophagus and respiratory tract are separate, distinct features. Indicate that the superior end of the respiratory tract will become the larynx and trachea. The respiratory diverticulum bifurcates to form the primary bronchial lung buds, which expand into the surrounding splanchnic mesoderm. As a clinical correlation, write that esophageal atresia occurs when abnormal separation of the esophagus and trachea interrupts the normal course of the esophagus and causes it to end blindly. In many cases, however, the esophagus and trachea remain connected, a tracheoesophageal fistula. Next, show that in week 5, the primary bronchial buds give rise to secondary bronchial buds, which sprout in a set pattern that reflects the future lobes of the lungs. On the right side, indicate the superior, middle, and inferior lobes, each of which comprises a secondary bronchial lung bud and the surrounding mesoderm. On the left, indicate the superior and inferior lobes. The asymmetry reflects the fact that the mature heart will nestle into the ventral medial aspect of the left lung. Indicate that the outermost layer of the surrounding mesoderm is the visceral pleura. Now show that in week 6, which is the start of the pseudoglandular period, the secondary bronchi give rise to tertiary bronchial buds. The lobes of the lungs expand to accommodate each new round of branching. Finally, let's show the structures that arise between weeks 16 and 36. We'll zoom in on a single tertiary bronchus, which is the foundation of a bronchopulmonary segment. Indicate that it gives rise to multiple bronchioles, which then undergo additional rounds of branching. During the canalicular stage, terminal bronchioles give rise to respiratory bronchioles, which are enmeshed in pulmonary capillaries. Finally, during the saccular stage, the respiratory bronchioles give rise to alveolar ducts and sacs, which open to the primitive alveoli. During gestation, the lungs do not participate in gas exchange. However, they do perform vital preparatory work. Type 2 cells of the alveoli produce surfactant, which reduces surface tension and prevents alveolar collapse during postnatal respiration. The importance of this is highlighted by neonatal respiratory distress syndrome, also referred to as hyaline membrane disease, in which insufficient surfactant allows alveolar collapse, atelectasis, upon exhalation. Infants born prematurely are at higher risk as their surfactant production is incomplete. This concludes our diagram.